elimination diets are a baseline. When I first see people, the first thing I do is give them an elimination diet while we investigate. The next thing is probably the methylation products, the things like folic acid or vitamin B12, to get the metabolic responses up. Huge amount of chronic fatigue syndrome research is mitochondrial disorders, and getting the mitochondria functioning is the same for adults and children. The paradox is, though, that children with these disorders often present as hyperactive. They can go one way or the other. In adults, the hyperactivity is not quite so obvious. The depression and the flattened affect and the thyroid inhibition is far, far more common. So it's almost like you've got lots of potentials as a child, and as you go through life, they become more and more kind of petrified into one style of response, which is a depressive, slowing down, almost like a hibernation response. And that's it's a useful model to come back with. Nearly all my patients get probiotics. The gastrointestinal tract, again, not obvious. Why would autism, behavioural disorders have the gut as the main area of focus? Well, clinicians in the chronic fatigue syndrome found exactly the same thing. Clinicians in chemical injury and sensitivity found exactly the same thing, that when you're going looking for these things, the gastrointestinal tract is open to treatment and is always abnormal. So that's a good starting spot. I don't think I've ever seen a person whose gut is not involved in this area. So there's a reason to go and manage it, because the substances we use are safe and effective. They're not heavy drugs. We don't have to go down that path.